Hi, on this segment of Ask Dr. Julie, I have a really great topic to talk about today. When is double vision serious? All right, so let's show you what is double vision. Well, if you're reading and suddenly the print does something like this, where it blurs or doubles up, or even looks like it's sliding off of the page or is wiggling around, that is double vision. Now, when is it serious versus when is it kind of not really a problem? Well, it's important for you to know the difference, because the difference between the two might mean that you need to go get care right away versus maybe you don't need to get care right away. For instance, if you've had double vision for a lot of years, like, oh, I've had double vision that I see off and on for the last 25 years. Well, that's not a matter of probably something being super serious. However, I still say go see your eye doctor, have that looked at, find out what's the cause for it if you don't already know, and do something about it. But let's say that you happen to wake up all of a sudden one morning and you look off and you're like, oh, wow, I've never seen double there before. Or that's never been double before. Or what if you're driving down the road and all of a sudden you see multiple lanes? And that's never happened before. What if you don't feel well? Like you're feeling really bad, like I feel green, my heart's racing, or I feel sick, I feel like I'm gonna throw up, or I feel like, oh, I feel like I could just faint and pass out, and you see double. Those are instances that I woke up with it, all of a sudden I saw it, I'm feeling really bad, like health-wise, my body is not feeling good, I'm feeling sick, I feel like my heart's doing something unusual. Those are all kind of circumstances that you need to be going, uh-oh, I need to go see my doctor, right? Whenever you have those sorts of circumstances, I'd even suggest go to the ER. Don't just go straight to your general doctor, because those could be very serious signs. You don't want to mess around with those. A lot of things could be happening. One of them could be that you could potentially be having a stroke, or you could be having a cardiovascular incident with your heart that's causing it. So, or blood vessel, something else in the body, in the brain. There are multiple things that could be going on. I won't go into all of those details, but don't ignore those. So again, what are the ones that are serious? Well, it's not the one that you go, oh, I've kind of seen double off and on for 25 years. Yeah, my doctor knows about it. We've talked about it before. Haven't really done anything about it. That's not super serious. Go have it checked out, find out the reason so you actually know. Is it coming from a condition called convergence insufficiency? Is it coming from a condition called strabismus? Convergence insufficiency is where you can't cross your eyes and line them up to a target. Strabismus might be an eye that is turning out, in, or up. So if it's happening from one of those things, you need to know, because other doctors are going to say, like, did you know you see double? And you need to have some information. Like, this is part of you being a responsible adult, being able to tell another physician what's going on with your vision, so they don't go send you for imaging if you've had this for 25 years, right? Because they're concerned and worried about something that could be going on in your brain. However, here's the serious ones again. You wake up all of a sudden and you're like, I've never seen double before. You're driving down a road and all of a sudden you see multiple lines, and that's never happened before, right? You're not feeling good. You're feeling like your heart is doing something crazy, either like pounding out of your chest or like you're super, super overheated. Okay, that would be 4. Maybe you just feel like, oh, I feel like I could faint and pass out, right? And you see double in any of those occurrences. What happens if you have a really serious headache? Like, I have the most awful headache in my life right now. If you were to say those words and you experience double with them, go to the ER. These are all circumstances you do not want to, play off, pass off, just kind of go like, let's just wait and see what happens. No, don't do that. Okay, what is double vision again? Well, this is what it looks like. So what's another circumstance or situation in which you might not be all that concerned? Let's just say that you've been reading for 16 hours straight, or doing Maybe you've been doing all of your homework online or all of your work online during all this pandemic that's going on. And maybe you are like, oh my gosh, I feel like I'm seeing double. Okay, go have that checked out. But that's not necessarily the circumstance, especially if it goes away and you never have it again. Okay, that's not necessarily the circumstance that you need to be super worried about. All right, it's the ones where you're like, this happened suddenly. Why is this happening suddenly? I'm not feeling so good. Remember all of those things. Okay, there were 6 of them. Those are super important. Don't forget them. All right, it could be the difference between good health and a serious problem for you. So again, please take them with seriousness. If you do happen to have issues associated with, maybe you have had a stroke, maybe you do have a convergence problem, maybe you do have a strabismus, maybe you do have a problem where after working on a computer you see double for a period of time and then it goes away once you rest your eyes. Those are all situations that we can still help you with. So obviously you're getting our information probably if you're on our YouTube channel or you're in our email system, but go to visionforlifeworks.com, fill out the questionnaire for us if you're not in our system already or you haven't done anything with us before. And that will kind of, once you fill out that questionnaire, it will send information back to us. We can contact you and find out if you're a good candidate for us to help you. Or you can give us a call. If you want to just call our office at 618-288-1489. Please be patient with us during this time of pandemic because we might not be able to get to you immediately. But again, if it's an emergency, go to your ER. Don't just sit and wait it out and see what's going to happen. We don't want that to happen for you. And we want you to take it just as seriously as you should for your health. And with that, I'm going to say thanks for tuning in. Stay tuned. We'll have more Ask Dr. Julie's coming up.